Good day, everyone. We are here with a group of clinicians that share the same values and the same interest in working on TB and HIV, collaborating services, research projects, clinical aspects of care. And we will be discussing today various topics, but basically focusing on how research projects and good clinical practice can scale up in a country and rest sustainable over years, and how research projects can actually shape the agenda and change policies at national level, regional level, bring more evidence, and bring more data into the decision making. So we have here colleagues from Georgia, from Macedonia, from Ukraine. And we also have the moderators that are basically represented from Denmark or activating right now in Denmark. So it's a very good group of countries that is working on various initiatives. But as we work on various initiatives in different settings, we all know that maybe we have the same context, we share the same interest, but we have different circumstances. So maybe to start our discussion would be good to break through with the question regarding what, in your opinion, in your countries, can be identified as a successful practice or clinical approach that was used at the level of your country to change the policy, to make services more collaborative, and also at the same time more sustainable in time around TB, HIV care, or other infectious diseases and the comorbidities around that. We know that Georgia is having very good models of collaboration in between HIV and TB services, offering more testing, maybe at the same clinic. We know that Macedonia had some examples, also on scaling up some services, and Ukraine definitely has special circumstances as well to tell us how should we work in a disaster setting. So maybe we start with Georgia, if you don't mind, to let us know if you can identify one practice from your clinical work that actually was successful in terms of cooperation in between services and also made it sustainable over time.
Okay, thank you. So we have, I think, yes, very successful collaboration with TB Center, but also I would like to emphasize that we have the separate centers, TB Center and HIV Center, and but despite that, we have good collaboration, and I think it started several years ago with EuroSIDA project, because there was very interesting project, and we started very close collaboration with our colleagues from TB Center, and after that we continue our collaboration. Yes, of course, we have the problems with that because we have the separate vertical centers, TB Center and HIV Center, but we try to manage this situation. And of course, Nino, if you would like to add.
Okay, let me more detailedly
yes.
describe how we are collaborating with the center.
Exactly.
Then,
did you start with what clinic?
Yes, so let me mention that screening in both centers are what I'm meaning that in TB Center, all patients should be screened for HIV. It's one good thing what they're doing, and also in our clinic, when we got patients, we are also screening them. It's like these 4 questions for TB diagnostic when we are screening and sending them to them, or maybe some different laboratory tests, which we are also doing there. It can be IGRA test, or it can be CT scan, or it can be a sputum gene expert test. So we are doing this, of course, but still, if we are if we are thinking that we are having some TB problem, problems there, yeah. So we directly, because it's different institution, we're sending to TB center where they're excluding active TB infection, and also they are prescribing TB preventive treatment. And as Natalia mentioned, we have very good collaboration with the sending, screening, and if patient is diagnosed with TB, then treatment of TB. But second part is that if patient doesn't have any TB infection, for example, yeah, and they feel themselves quite good, so it's problematic to send them once again there to start preventive treatment. And this is gap which we are trying to somehow manage, and yeah, we are sending directly to patient. We are contacting with the TB doctors and like collaborating to each other. But still, we have some missing there, but we are doing our best somehow manage and cover this part.
So a successful factor is that you had the testing tool available in both sides,
Yeah,
at the
free.
TB clinic and the HIV clinic.
Yeah.
If you mean the testing, for example, IGRA for latent TB or TB infection or Gene Expert, yes, and also we have the test for other sexually transmitted infections, and we can do it in our center. Yes, it's very comfortable, but for treatment, we should, for example, refer the patients to the special centers. And yes, diagnostic, it's very good, and yes.
Yeah, for STI clinics, for example, Natalia mentioned that, yeah, if we are confirming some, for example, syphilis diagnosis, we should directly send them to the venerologist for the treatment, because also it's a separate institution, like in, I think, many countries, the post-Soviet Union countries. So, yeah, it's like transferring this patient gives some problems, but still good collaboration is covering this problem, and somehow we have good results in this field.
And I have like a question on this topic. So this is when you refer patients to another center, to your colleagues.
Yeah.
Is it working both sides? So if a TB center, for example, has a patient with tuberculosis and HIV, a positive HIV test, do they contact you? How is the collaboration going another way? And the same for STI clinics if they identify an HIV patient?
Okay. Of course, in TB center, if patient is identified and HIV positive, of course there is the, for example, they refer the patient to our center, but if there is the hospitalized patient with TB, in this case we have the mobile service, and in this case we can deliver our, first of all, we can visit the patients and consultate the patients at the hospital, and also we can deliver the medications. So it's, yes.
So you go...
yes, we go to the TB center, to the hospital, we visit the patients, and also we prescribe the antiretroviral medications and also other opportunistic infections for other prophylactic, and we can deliver the medications to the hospital. So it's comfortable, I think, for patients.
So the people-centered approach that is pretty much promoted by NTB strategy and the global strategies on infectious diseases is somehow implemented in Georgia, as I can hear, maybe at least for the screening, for sure. Yeah. How about Macedonia and Ukraine? Can you identify from your work examples that are really illustrating this collaborative interaction in between services?
This conversation actually reminds me how we start our collaboration with our colleagues at the Institute for TB. We as well have different clinics, HIV clinic within the University Clinic for Infectious Diseases and Febrile Conditions, and the Institute for TB, who is covering TB and pulmonary infections and diseases. We are only one center in the whole country, since North Macedonia is a quite small country.
Small.
And
but strong.
Sorry?
But strong.
But strong, yes, of course, of course. At the early 2000s, when I believe all of you remember the VCCT centers, voluntary, confidential counseling and testing for HIV, when we start introducing those VCCT centers in the country, we invite the Institute for TB, colleagues from the Institute for TB, to join us and to open one VCCT center within their institute in order to counseling and test for HIV patients who are suspicious or already diagnosed to TB. So we thought that it's a good way to test people, since we thought at the time, as you were right, that our HIV diagnoses are underestimated. So we did it both ways. At the Institute for TB, they tested HIV, and we start testing TB among our already diagnosed, newly diagnosed HIV patients. So for every newly diagnosed HIV patient, we did a TB test. At the time, it was a skin test, today IGRA and the rest. But sometimes we are sending our patients to the institute, but if there are more patients at the moment, and in order to be in a more, let's say, clean settings, okay, we are just taking the epruvets from the institute, drawing blood together with the rest of the checkups, and just sending the blood samples to the institute. It is in the both ways. And regarding the sexual transmission infections, it was more or less collaborative, but it was especially organized, more tight connection with the Clinic for Dermatology when we introduced PrEP. And we started finding quite a lot of syphilis. We invited a young doctor, young dermatologist, who was willing to do with venereology, to be part of the project, because we started as a pilot project, and to come at our clinic when we are doing PrEP. Today, he's even coming for checkups for the patients. And of course, we are sending patients to the venereology clinic as well, but with no really remarking much, are they checked up at the venereology clinic or our HIV clinic. So I believe besides the well-organized and built system, as the one we had with the Institute for TB more than 20 years, it's very important if you motivate the colleagues, especially the young colleagues, to take part and to find their professional medicine in the field of HIV.
I know that now Ukraine is one of the few, if not the only one, countries in Eastern Europe where you have HIV and TB services united under one umbrella on an organizational level. And you started this process like maybe already 10 years ago with a few pilot centers, but now it's all over the country. Can you please share your experience in this? Is it working?
Yes, yes, absolutely. And now mostly in all regions of Ukraine, we have united hospital, HIV, TB, and infectious diseases hospital in one big hospital. And really it's a good decision, because now we can test in patients in one clinic for HIV, TB, viral hepatitis, and treat all this infection in one unit. And it's possible, for example, for infectious diseases doctor to prescribe the prevention therapy of TB, and we can, in the close cooperation with TB doctors in our clinic, for example, in my region, and really we can see the good effects of this approach in all of the country, because we can follow up for all these patients with co-infections and treat hepatitis also in this clinic, because it's free for all the patients who need it. Yes, and I also should say that in Ukraine now implemented the program of government medical guarantee, and this program includes the free testing for all people who enroll to the army for HIV, for hepatitis B and hepatitis C. And this is really very important point for us, because we tested a lot of people, and amount of tested people from last year's increased by 40%. And we can see a lot of positive tests, and incidence of hepatitis B and C increased sharply
for last years when the war started, and it also like a good point for our possibilities now to treat these patients, because government program covered all these patients for treatment hepatitis B and C, and it's free of charge.
It's an amazing example, I think, that how country in the context of disaster, in the context of war, managed to progress and develop.
Yeah.
So I think it's a very good example, and it deserves a lot of appraisal.
Yeah, and maybe it's also a very good approach, because now we can treat patients with HIV infections anywhere. For example, at the real point where they stay. We can send, in cooperation with NGOs, we can send the package with ART to frontline, for example, or for any points where the patient internally replaced patients can live, and it's also very important to keep them under care.
So there are many factors that I hear here in the conversation that need to be taken into consideration. And first of all, in all your examples, it's coming very crystal clear that available tools and the good diagnostics being available at both sides when the services are still split in HIV and TB and even hepatitis, it's very important to have those tools to actually implement that, and to have the funding and commitment of the government to actually enforce that this is happening as models of services and care in countries. Macedonia colleague told us how important it is to actually check for quality, that the services are really provided to the end users, and it's not just on the paper. So we need to assure that there is some governmental stewardship and some monitoring behind it, and definitely equitable access for all for these services. And that is not only making a one-stop shop and having services available only at one clinic, but also being active and collaborate across services, go to each other so that we assure that the patient is receiving care. So in this context, we are all working in a joint project that also focuses on gathering more data and maybe enforcing and strengthening the evidence behind the good practices in Eastern and Central Europe. Can you actually also reflect on some examples from your practice on how the research component and the gathering of data and the good coordination of using this data in future could influence the decisions in the country, maybe empowered you to convince the government to scale up the models to other clinics? So maybe you can have some examples of this work so that we can all talk about the leadership of your countries to be as an example for others. Maybe Macedonia can.
Yes, it's very important to say, especially when you are coming from a small, strong, but still small country like North Macedonia. And until recently, I was the only doctor treating HIV in the country. It's very difficult to explain that you are right, that what you are doing, whenever you need to scale the services, it's because, not because you're a spoiled doctor and you want to be fancy, but you need this for your patients. Today we have a nice team, supported very strongly from within the NGO system and the community organization, supporting and helping us very much. It's very important when you refer that colleagues from the rest of the world, from Europe, from the neighboring country in the region, are scaling up, because this is the science, this is the evidence base, and that your patients are in need for this, and they deserve to have better treatment from one hand, it's much easier to present this. It's much easier to fight when you clarify something with the whole community of HIV doctors and science is standing behind of you. As well, all your data from the work you've done and analysis you've made with your patients, when you send within the research, like we are doing now with the HIV and TB, it's clarifying that you're doing well. And together with the results of the other colleagues, yes, you're improving the science, and it's a good feeling for the doctors and the team, but as well for the patients who are receiving every day better and more organized health. Yeah,
you're absolutely right, and I cannot imagine any HIV clinician today who is not participating in a research project. Yeah. It historically it works in this way that HIV doctors and research, it goes hand in hand together. Yes. And for example, also I know that all of you participate in some research projects with Western countries, with United States or European countries. You in Georgia, you also received grants from WEEPI Foundation. Can you tell a little bit more how, if results from this research projects changed your daily practice, maybe not on a government level, but on a level of your particular center, and the same for center in Ukraine?
So I can say about the hepatitis C elimination program, which was and which is very successful program. So it was started with collaboration of US CDC, and so we have very, very good results. And of course, after that, nowadays we have the free of charge blood, safe blood testing in our country. And it is not only in our center, in other hospitals also, and it's very, very important. Also, we started the hepatitis B elimination program 1 year ago, approximately, and we hope it will be very successful, and such kind of collaborations are very, very important for us.
But this kind of collaboration was that, because you say it's successful, it was started with some external funding, right?
Yes, yes.
What did you exactly do to make maybe the governmental funding coming in or additional funding coming in? Did you use data from this project?
Yes, of course.
And how this convinced the other decision-making
It's very important. It's very important. When we have the results of successful project, it's very helpful for example, funding additional additional resources for the future projects, and it's very important. Also, we have the WEEPI project.
Let me mention that, it's like infection diseases problems, which are more or less covered and quite good in Georgia, but still our patients are getting older. We have a lot of problems with non-infection comorbidities, and we're seeing it much. And 4 years ago, we started WEEPI project. It was non-HIV associated comorbidities, which was covering 3 different directions, like it was cardiovascular diseases, it was endocrinological problems, and also some kidney problems. And in this project, it was extra funding for the specialists, and because our governmental program for HIV was covering all the examinations, laboratory tests, or other things, but still, when patients get all the results, still we need some professionals to be send these patients, and sometimes it was a problem of funding maybe, so they're not going there. And we have seen this a lot. So in case of this project, we have 3 specialists specialists, and we started very good collaboration with them. And after 1.5 years, we included these specialists in our governmental program. So nowadays, we have them, and all our HIV patients who needs to get this consultation of the doctors.
So do I hear correctly that you offer testing services?
Yeah.
You started testing more, and you started identifying more health problems that need to be addressed.
Yeah.
And you collected data behind it.
Yeah,
And you were able, on an annual basis, to present some results that were showing that as we offer more services, we are able to address more health problems.
Yeah.
Yes.
Is that how the data work?
Yeah, and it's even worked still ongoing grant. So yeah, it was very helpful, and now it's working quite good. So,
Okay. Did you publish your data?
not yet, but
Not yet,
it will
but
be.
still in
Yeah,
process.
yes.
Okay,
Yeah.
that's very important because we
We
talk
finished,
about
just
evidence-based.
finished it, so that's.
Yeah.
Yes, and in Ukraine we also have the good example of pilot project, for example, with tablet prep. We started few years ago. It was like small project only for Kiev, and after that prep program was implemented for all countries, and now we have more than 10,000 people who received prep, like prevention of HIV infection, tablet regimen. Last year we started to implement like project cabotegravir for PrEP. And now also we have a good result, and this year we started to negotiation the possibility to implement like project Linkopavir for PrEP in Ukraine. So it's also for us it's like incredible possibility for our patients, for our MSM, and I hope that it will be successful for our country and to have next steps for implementation.
So it's another good example of accumulation of
Yeah.
data. We are running out of time, but if I may ask you of one thing you wish to improve within the next year in your country, what it would be?
How can
In terms of management of HIV infection.
Maybe I think that one-stop sharp service, it will be nice. But yes, we have the very close collaboration, but it will be good and better.
So
Yes,
even
one
closer,
window
one
service,
window
yes,
services.
yes, it will be better,
Yeah.
I think.
And also, I have one hope that we will live in peace. And in these circumstances, our work will be more successful, because our soldiers will come back. A lot of our citizens come back to Ukraine, and we will have a lot of works in the context of HIV, viral hepatitis, and TB. And but our hope is the peace.
You have a very good background to develop and to raise it further. Yes, yes.
Well, I'm still thinking, even after all those years of treating HIV, almost 30, that I'm still struggling with stigma and discrimination, and I think this is one of our biggest problems. That's why I think that we should send our patients more to general clinics as the rest of the patients. And I'm often saying them that they are spoiled, our patients, because I'm always sending them with a particularly arranged checkup with a particular specialist. They don't know how to wait in the queues, but I'm afraid this is why a lot of our colleagues doesn't deal with HIV, then they have issues. And I think we have to involve all of our medical colleagues, internal medicine, surgeons, psychologists, psychiatrists, within our HIV treatment, so they can be more
friendly services.
Friendly.
This is a very good point, and I back at the beginning of HIV epidemic, infectious disease doctors worked a lot on education of colleagues from different specialties, but then also in line with improved treatment of HIV infections, this education sort of wanes. But I feel from many other colleagues in different countries that there is a need for, again, to
I totally agree with
restart this education of across specialities.
because screening still stays, I think, in many countries the problem and
Exactly,
gap.
yes.
Because still in our country, 1/3 of the newly diagnosed patients still are in stage 8. So still it's big gap. So yeah,
Late.
GI doctors should be more educated, and I think we should, governmental directly should do this, but also we will work with this, and it's no problem for us to go with educational things to them.
We are all working together on another project now dedicated to management of TB infection in people living with HIV. It is an international project that unites all of us, and we're all working hard on collecting new evidence and new data. And I would like to underline that by collecting new data or new evidence, this is the best way to convince our peers in changing recommendations, guidelines, and everyday practice. So research is very important in the context of clinical practice. In our situation, it is very important in management of people living with HIV. We still have a lot of unanswered questions. How TB and HIV interacts on a cellular level, and what is the best way we manage a dual co-infection. So I don't have enough words to underline how important is collaboration and research projects in this area in order to move forward and improve care for our patients.
So all countries are working towards one goal, to make better services and to offer better care for their people and to improve health. But we all have different contexts. And in some countries, there are more resources. In some countries, there is the government that is more committed to support TB and HIV collaborative services and go beyond that and also include hepatitis and STIs and comorbidities. In some countries, the advocacy is better working. In other countries, the entities-based testing services are scaling up, but we all face the same issue of trying to improve our data gathering and use this data in decision making, in our conversations with the community, in our conversations with the governments, which is very important to shape policies, to also see if we are going on the right track with our internal practices and to document those good practices. And as our colleagues also shared, it's very important to think about how do we eliminate stigma and discrimination and work with those populations that need more of our attention. So summarizing that, this is probably a common goal for all of us to continue our efforts, implement research projects, promote implementation research, but also fundamental research, implement the scale-up innovations, and continue the dialogue, the evidence-based dialogue, with our policymakers and the community to make all our interventions with high impact. This was the conversation today. We hope that we will continue our dialogue further with the countries that we had hosted today, but also with other countries in the region, and make sure that the leadership there, where the good practices really win, will continue through the European region overall. Thank you very much for your attention today, and we hope to see everyone interested in what we are doing in the future.